interpretation of assessment data. So these are not all the things, but in my 9 years of being a nurse, these are some things that I learned. So if you have a patient who has mental status changes, that could be either blood sugar issues, that could be a stroke, or a patient just having lack of oxygenation. So that's why it is so important to get a baseline assessment done as soon as possible, because like I say, if something goes down, we have something to compare it to. If your patient now is dealing with irritability when they weren't all before, that can show a lack of oxygenation and infection as well, especially like in the elderly. If you see that the patient's limb is cold or pale, that's an indication of possible lack of blood flow. If a patient has decreased blood pressure and increased heart rate, that could mean they're in a hypovolemic shock, or that patient has some internal bleeding going on. Yellow or green drainage, infection, bright red blood, that is a new bleed, and if something is hot to touch, and if you smell a foul odor, that is infection. So these are just the little takeaways that I've gathered throughout my nursing career. So this is not the all be all, but it is so important to get a baseline assessment done as soon as possible. So you're like, Nurse Doc, I don't even have patients on my own. Well, in nursing school, it is so important to pay attention during your health assessment class when the instructor is going over all of the normal ways. So how normal skin turgor is, right? How normal pulse to feel. So when you feel or when you hear something abnormal, then you're able to do something. So it is so important that you just remember what's supposed to be normal. So how is the skin supposed to look? How is the heart supposed to sound? What are breath sounds supposed to sound like? And then if we hear or see something different, then that could alert us that something is going on.